Well, hello, everyone. Thank you for taking the time to watch our interview today. I'm Dr. Monica Tillett, Doctor of Physical Therapy with New Direction Rehabilitation and Wellness, and we're a mobile outpatient clinic serving adults in the triad, helping them age well, enjoy their lives, and maintain independence. And we do that through helping people with pain management, helping with them with balance and fall education and training, but then also with strengthening and exercise progression. And I like to interview different people in the community who help us achieve those goals with our clients. And today I have Leah Gallimore with Anew Body and Wellness, and they are doing a phenomenal job here in the triad, helping adults as well, manage different pain and other issues. So I'm going to turn it over to Leah and let her introduce herself.
Good morning. Thank you for having me here today. As you already said, I'm Dr. Leah Gallimore. I'm a doctor of acupuncture and Chinese medicine, and I am a licensed acupuncturist in the state of North Carolina. And I'm also an NCCAOM diplomat and owner of Anew Body and Wellness. And we practice acupuncture and Chinese medicine.
Awesome. So, most people are probably wondering what that is. And so tell us a little bit more about that.
So acupuncture and Chinese medicine, they go hand in hand with one another. Acupuncture is the insertion of a filiform needle into a specific point to get a reaction, and depending on where you're needling and what you're trying to do as to what kind of reaction the body will have. And Chinese medicine basically is the aspect of herbal formulas. So we are herbalists, and we do treat with, there's over 300 different herbal formulas in our toolbox and over 1,000 different single herbs, but we don't treat with just single herbs. We actually do treat with formulas. Acupuncture and Chinese medicine has been around for over 3,000 years. So there's a huge history of our medicine.
Awesome. And so what would you say, because most people may say, I've tried everything for pain. I've gone to this person and that person. And, what would you say would make your services different to where give people hope that you are something different and can help them?
I think the biggest thing that's always brought me patience is the fact that I myself have gone through chronic pain. I started as a professional dancer who had an injury that sent me into just a little over 2 years of constant pain. I know what it's like to your body not do what you want it to do, and to be able to, at one point, to be able to do certain things, and then all of a sudden after an injury, you can't. So I come to my patients with that understanding. And when you go through chronic pain, and I myself tried everything under the sun, you name it, and I finally found acupuncture and Pilates, and the mixture of those two together for me worked. What I've realized with working with chronic pain for a really long time is that everybody's journey is different, and the things and the tools that work for every single person is different. And so you really do have to find what works for each individual person. And then also addressing, the trauma itself. It really is quite soul wrenching when you go through chronic pain. And when you are having difficulty walking from a chair into the bathroom or into the kitchen. And so, when I approach my patients, I approach them from many different aspects. Chinese medicine in general, we do the whole body. So when I have an intake, my intakes usually take half an hour to 45 minutes, and I talk about things that have absolutely nothing to do with your chronic pain or your injury or anything, because there's different aspects to it, and we do take the whole body into consideration. And so when someone comes to me One of the things that I want to do is I want to look at their whole body. You know, we may find in an intake that they're also having constipation, and that when the constipation flares up, so does their low back pain. So when I have a treatment, I'm going to treat the constipation as well as the low back pain. And also, you know, there's been a great deal of research about trauma and the effects that it has on the body. You know, they've been research done on Holocaust survivors and how that trauma affects their bodies. And what they researched and what they found is that trauma can actually change the DNA. So in acupuncture, we have many different levels or channels. You have your cutaneous level, which is your skin. Then you have your tendinomuscular, which is where trigger point therapies that people do, where they access that, and they can dry needling for that as well. That's another level, and that's the next level down. But after that, in acupuncture, we have many different levels. And from a biomedical perspective, you know, you have your levels of bone, you have your levels of organs, you have your levels of blood, you have spinal fluid, and you have DNA. And so our levels in Chinese medicine also correlates with the biomedical levels in the body. And so when I treat trauma, or I treat trauma, chronic pain, I'm going to go to these different levels because we've had training for that. And I'm going to also try and get some of that trauma out that's associated with that pain. So that's how I treat as far as the session itself. And then I also, you know, most of my patients come to see me once a week, and I have them for an hour. The initial visit's an hour and a half, but after that, they come for an hour each week, and then they're off on their own. And so one of the things that I want to do is I want to empower my patients so that when they are at home and they are having an episode of pain, because it's going to happen, there's no instant fix for anything. I want to give them tools so that they can use at home. So it may be a breathing exercise. It may be a core strengthening Pilates exercise. It may be some Feldenkrais. There's many different things that you can do to give them that they can be empowered. So that's another aspect of how I treat.
Wow, Leah, you said so many nuggets in that, because I hear this all the time. Actually, someone just called me yesterday, and their major complaint was, no one is listening to me about my pain. And just listening to you and having gone through chronic pain yourself, that gives you just a different awareness from where they're coming from. And, you know, sometimes people just want to be heard. And I just think that that is so powerful. But also the knowledge, I hear the knowledge behind your treatments. And that also is something that people are looking for. They want to know that when they go to you, you actually have a purpose to why you're doing what you're doing. And I just love that and hear that. But the one thing that I really, really love that you just said was you teach them things that they can do at home. So you're empowering them to continue on with their wellness on their own. And so many times people, when therapy is done or their whatever treatments are done, sometimes they sit and think, well, what in the world am I supposed to do now? What do I do to continue feeling better? And so I love that. I love that. Are there any conditions that you can't treat?
You know, acupuncture in Chinese medicine there really isn't much that we can't treat or can't improve on. There is so much research that shows how we support pretty much any Western medical condition. You know, it really is a beautiful complementary medicine, you know, and take, for instance, if someone is going through chemotherapy treatment, acupuncture is really great at treating some of the side effects to it, like nausea. You know, we are really good. There's evidence about how we can support high blood pressure, you know, along with your Western medical pharmaceuticals. We are complementary to it. So there really isn't much that we don't treat. We're really great at women's health and men's health and balancing hormones. We're just really good at supporting.
That's awesome. That's awesome. So how can people contact you? Where can they find you?
So I am in High Point. My address is 1001 Phillips Avenue, Suite 101. You can also access me through my phone number, which is 336-891-9167. But you can also access me through my website, which is anewbw.com. That's ANEWBW.com. And there's, lots of information there. You can book an appointment directly through there, or you can, give me a call either way.
That's awesome. And I will put that information in the post. And is there anything else you'd like to add, Leah?
I would like to say thank you for the time, giving me the time to come and sit with you and ultimately sit with your patients who do look at this. We are a small community, and it's important that we all support one another. And ultimately, when we do that, our patients are the ones who benefit from it. So thank you for allowing me the time to sit with you and to sit with your patients.
You are welcome. Thank you. So everyone, again, this is Dr. Leah Gallimore with the Anew Body and Wellness, and feel free to connect with her. She's awesome. And most importantly, we want her to help you with your pain. So thank you for joining, and have a great rest of your day.